Many of you may wonder, what is sickle cell anemia? Sickle cell anemia is a very severe disease that goes unnoticed by many people around the world. Sickle cell anemia is a disease where the body forms sickle-shaped red blood cells in the form of a crescent. I happen to be one of the 12 African Americans suffering from sickle cell anemia. I will now tell you the causes and effects of sickle cell. Sickle cell anemia comes from two people with AS genotype or AS and SS genotype. Sickle cell trait would be coming from someone with AA and AS genotype. Sickle cell trait is not as severe as sickle cell disease. The genetics of sickle cell anemia say that sickle cell trait becomes sickled when they are in low air pressure. Now that you understand the small facts about sickle cell anemia, I will now tell you the statistics of people suffering from the disease. The CDC says that sickle cell anemia affects 90 to 100,000 Americans. It occurs in 1 out of every 500 Black African American births. It also occurs in 1 out of every 36,000 Hispanic Americans. Sickle cell anemia occurs among 1 in 12 Black African Americans. With the information mentioned above needed to understand sickle cell anemia, I will now tell you the effects that it has on one person's life. I will even list some things that I go through with the disease. The most common signs of sickle cell are pain, fatigue, dizziness, headaches, coldness, and jaundice, which is the yellowing in eyes. The top sign of sickle cell anemia would be pain. When in pain, a person with sickle cell anemia goes through something called a crisis. Crisis affects the bones, lungs, joints, and abdomen. They can also affect the respiratory system. When affecting the respiratory system, it is called acute chest syndrome. Acute chest syndrome can cause pneumonia, fever, and pain. To treat acute chest syndrome, you have to be put on a breathing machine. When a crisis starts, it has many effects on the body. It can block blood flowing to the limbs and organs. Pain can be acute or chronic. Acute pain is meaning sudden. Acute pain is also the most common. It can range from mild to severe and last from hours to weeks. Chronic pain can last from weeks to months. Chronic pain also can stop one from doing daily activities. When having a crisis, one may have to be hospitalized in order to get the correct treatment, such as blood transfusions and medications. The National Heart, Lung, and Blood Institute tells that there is no cure for sickle cell. This is a lifelong disease that has not been cured. Now that you know the symptoms of sickle cell, you may wonder how a person lives with sickle cell on a daily basis. When living with sickle cell, you have to be very careful with the activities you do. A person with sickle cell anemia cannot do many regular activities, such as randomly jumping in a cold pool, smoking, or even drinking. When randomly jumping in a cold pool, that will send the blood cells into a crisis. You have to be very careful, such as taking precautions like making sure you are warm before getting in the pool and making sure you're warm when you get out of the pool. We also have to be very healthy and hydrated. Dehydration is the main cause of a crisis with sickle cell. Sickle cell anemia is a severe lifelong disease that many people around the world go through daily. Now that you understand the severities of the disease, I hope you are able to take some of this information and inform others about the disease.